To understand more about arachnoiditis, we need firstly to look at the workings of the central nervous system. Dr. Charles Burton of the Low Back and Neck Care Centre in Minneapolis is widely regarded as one of the world's leading authorities on this disease.
The most precious asset that any of us have is our intact nervous system. And our intact nervous system is surrounded by membranes. The closest membrane is the subarachnoid space, which is the pia and the arachnoid. And the subarachnoid space creates the spinal fluid that bathes the spinal cord, covers the brain. The brain rests on a cushion of spinal fluid, and the spinal fluid is produced by the subarachnoid space. In the lower areas, it ascends up over the brain where it's absorbed into the venous system. This is the nutrient for the brain. It is the support of the brain. I refer to the subarachnoid space as the salum sanctorum. It is the most precious and fragile environment in the human body.
If we look at a cross-section of the chorda equina, we see that there are three layers which include the dura mater and the arachnoid membrane. And contained within these layers are the spinal nerves, which in turn are bathed in spinal fluid. Let's see what happens in some patients when we perform a lumbar puncture, injecting a contrast agent through the dural and arachnoid layers into the spinal fluid. The following can take weeks, months, or even years to occur. First of all, there is an inflammatory response to the foreign body, which produces scar tissue. Spinal nerves become enlarged and swollen, and the space between the nerves disappears. Over time, the nerve scarring increases, and the nerves adhere to each other and to the arachnoid and dura. As more scar tissue continues to be deposited, the nerves can seem to become part of the dural and arachnoid membranes. This is full-blown adhesive arachnoiditis. Throughout this program, many people refer to arachnoiditis and adhesive arachnoiditis as the same thing, but in reality there is a difference. Dr. Charles Burton.
Arachnoiditis is a very common phenomenon. Probably most people have some arachnoiditis. Everybody who's ever had any viral disease or mild meningitis or trauma or spine surgery has arachnoiditis. It is rarely of any clinical significance. Adhesive arachnoiditis is a significant pathologic entity. Adhesive arachnoiditis means that there is scar tissue, abnormal scar tissue, invading the subarachnoid space and producing scarring of nerves. And what we're really concerned about is not arachnoiditis. We're concerned about adhesive arachnoiditis.
In 1999, Dr. Sarah Smith completed an international patient survey with regard to clinically significant adhesive arachnoiditis. As part of this survey, she asked about patient symptoms. The 10 most common symptoms reported were pain, numbness or tingling, sleep disturbance, weakness, muscle cramps or twitches or spasms, stiffness, fatigue, joint pains, balance difficulties, and loss of mobility. In addition to these, there were many other symptoms reported, including bladder, bowel and sexual dysfunction, increased sweating, heat intolerance, flu-like symptoms, frequent infections, weight gain, trouble swallowing, difficulty thinking clearly, dry eyes or mouth, dental problems. The list goes on.
I've lost my career. I've lost my social life, my private life. You lose friends.
My arm was affected, and it felt as if someone had poured boiling oil on my arm. I can only describe the pain like that. It was extraordinary. I was putting cold compresses on, flannels, anything to the burning sense. If anyone's had a burn, you know what it's like.
So we can see that the symptoms of adhesive arachnoiditis relate to the whole body and not just to the spine. And for many, as Carol Ringham just said, the most frustrating thing is that you can have adhesive arachnoiditis, and although you have symptoms, on the outside you can look so well. This can lead to problems with doctors, benefits agencies, and even family and friends, as we'll see a little later. There are many causes of adhesive arachnoiditis. Unfortunately, as Charles Burton said, the subarachnoid space is such a sensitive area of the body that even blood is considered a foreign substance. Therefore, any invasive back procedure where the subarachnoid space is at risk from insult has the potential to cause adhesive arachnoiditis.
I now know, through reading about arachnoiditis, that it was the myelogram that probably did all the damage. But the myelogram, when they told me about it, was going to be my godsend. It was going to be the final test that would prove whether I had something wrong with my back or not. This is what they told me.
When the spasm starts, I call it a spasm. A lot of people call it a flare-up. To me, it's a spasm. And I start shrinking down and the pain starts coming. It's like if you could get hold of a thick wire cutter and literally force it into an S-bend or a shape it's not supposed to go. That's what happens to me. And I go further and further down and shrink smaller and smaller. And the more I try and push myself up, the more pain I get and the worse I get, until I just end up a total S-bend and I have to go to bed. And there's nothing I can do about it.
And I feel very sad for the boys because I'm not a mum. I can't go on the trips with them. I can't help out in school. And the worst thing is when people say, but you look so well.